The year 2020 will forever be etched in our collective memory. It was the year the world changed. The emergence of COVID-19, a novel coronavirus, plunged humanity into a global pandemic of unprecedented scale and impact. Our lives, as we knew them, were upended. The virus spread rapidly, crossing borders with ease. Fear and uncertainty gripped nations as case numbers soared. Hospitals struggled to cope with the influx of patients battling the respiratory illness. Lockdowns became the new norm, confining billions to their homes in an effort to slow the spread. The pandemic touched every aspect of our lives, from the mundane to the profound. It forced us to confront our mortality, to reevaluate our priorities, and to acknowledge our interconnectedness. It was a time of great loss, but also a time of remarkable resilience, innovation, and compassion. Healthcare systems around the world faced an unprecedented challenge. Hospitals were overwhelmed with patients, many critically ill and requiring intensive care. Healthcare workers, thrust onto the front lines of a battle against an unknown enemy, worked tirelessly, often at great personal risk. Doctors, nurses, and other medical professionals faced long hours, shortages of personal protective equipment, and the emotional toll of witnessing immense suffering. Many contracted the virus themselves, and some tragically lost their lives. Yet, their dedication never wavered. The pandemic exposed the vulnerabilities of healthcare systems, particularly in countries with limited resources. It also highlighted the critical importance of public health infrastructure, disease surveillance, and international cooperation. The pandemic triggered a global economic crisis. Lockdowns and restrictions on movement brought businesses to a standstill. Factories shut down, supply chains were disrupted, and global trade plummeted. Millions lost their jobs, plunging economies into recession. The travel and tourism industries were particularly hard hit, as borders closed and people stayed home. Governments implemented massive stimulus packages to try to mitigate the economic fallout. The pandemic accelerated existing trends, such as the shift to remote work and the growth of e-commerce. It also exposed and exacerbated existing inequalities, with low-wage workers, women, and minority communities disproportionately affected by job losses and economic hardship. Social distancing became a part of our everyday vocabulary. We were told to stay 6 feet apart, to avoid gatherings, and to wear masks in public. These measures, while necessary to slow the spread of the virus, had a profound impact on our social lives. Schools and universities closed, forcing students to adapt to online learning. Restaurants, bars, and cultural venues shut their doors, leaving our social calendars empty. Weddings were postponed, funerals were held online, and holidays were celebrated virtually. The pandemic forced us to find new ways to connect with loved ones, colleagues, and our communities. We relied heavily on technology, using video calls, social media, and messaging apps to stay in touch. Yet nothing could fully replace the warmth of human contact. Section 5. Education Reimagined. The pandemic forced a rapid and unprecedented shift to online learning. Schools and universities around the world closed their doors, sending students home to continue their education remotely. Teachers had to adapt quickly, developing new lesson plans and learning how to engage students virtually. The transition to online learning was not without its challenges. Not all students had equal access to technology or reliable internet connections. Some students struggled with the lack of face-to-face interaction and the distractions of home. Educators faced burnout and the challenges of maintaining student engagement in a virtual environment. The pandemic highlighted the importance of digital literacy and the need for equitable access to technology. It also forced us to rethink traditional models of education and to explore innovative approaches to teaching and learning. Section 6. Finding Strength in Isolation. The pandemic was a time of great isolation and loneliness for many. Lockdowns and social distancing measures limited our ability to connect with others in person, leading to feelings of isolation, anxiety, and depression. However, even in the darkest of times, the human spirit found ways to shine. Communities came together to support one another, offering help to neighbors in need, checking in on elderly relatives, and finding creative ways to maintain a sense of connection. Stories of resilience and compassion emerged from around the world. People found joy in simple pleasures, rediscovering the beauty of nature, the importance of family, and the power of human connection. The pandemic, for all its challenges, reminded us of our shared humanity and our capacity for empathy and kindness. Section 7. A global crisis, unevenly experienced. The COVID-19 pandemic was a global crisis, but its impact was felt unevenly. Existing inequalities, both within and between countries, were exacerbated by the pandemic. Low-income countries with weaker healthcare systems and limited social safety nets were hit particularly hard. Within countries, marginalized communities, including people of color, indigenous populations, and those living in poverty, experienced disproportionately higher rates of infection, hospitalization, and death. These disparities highlighted the systemic racism and social inequities that continue to plague our societies. The pandemic underscored the interconnectedness of our world and the need for global solidarity. It highlighted the importance of addressing global health inequities, strengthening social safety nets, and promoting equitable access to healthcare, education, and economic opportunities. Section 8. Silver linings, innovation and adaptation. The COVID-19 pandemic spurred unprecedented levels of innovation and adaptation. Scientists around the world collaborated at an unprecedented pace to develop effective vaccines in record time. Telemedicine and other forms of digital healthcare delivery expanded rapidly, improving access to care for many. Businesses adapted to the new reality, embracing remote work, e-commerce, and other innovative solutions. The pandemic accelerated the adoption of digital technologies in many sectors, transforming the way we work, learn, and interact with one another. The pandemic forced us to rethink our priorities, to find new ways to connect, and to appreciate the simple things in life. It highlighted the importance of science, innovation, and collaboration in addressing global challenges. Section 9. Moving forward, a shared responsibility. As we emerge from the acute phase of the pandemic, we are left to grapple with its long-term consequences. The world has changed, and we must adapt to a new normal. We must learn from the lessons of the pandemic and work together to build a more resilient, equitable, and sustainable future. This requires a collective effort. Governments, businesses, communities, and individuals all have a role to play in building back better. We must invest in public health infrastructure, strengthen social safety nets, and address the root causes of inequality. We must continue to support scientific research, promote global cooperation, and prioritize the health and well-being of all people. The COVID-19 pandemic was a stark reminder of our shared vulnerability, but it also revealed the extraordinary resilience of the human spirit. Section 10. A testament to the human spirit. The COVID-19 pandemic was a defining moment in human history. It was a time of immense loss, hardship, and uncertainty. But it was also a time of remarkable resilience, innovation, and compassion. The pandemic tested our limits, but it also revealed our strength. We learned the importance of community, the power of human connection, and the fragility of life itself. We emerged from this crisis forever changed, but also forever connected by our shared experience. The story of the COVID-19 pandemic is still being written, but it is a story that will be told for generations to come. A story of loss and grief, but also a story of resilience, adaptation, and the enduring strength of the human spirit.